Good morning, Sun Up on 7 family. You're here once more, and we thank you so much for viewing the show and for engaging with us on our many social media platforms. We're excited to start with our first conversation, and I hope you're excited as we are too. And we're going to be talking with the Belize Chamber of Commerce and their collaboration with the Ministry of Health and Wellness on a very awesome love-giving program, which is Giving to the Nurses program. And so to talk about the program, how this partnership happened, we have Ms. Yorshabell Cattouse, Manager of Membership Relations at the Belize Chamber of Commerce and Industry, Ms. Katherine Meighan, Vice President of Services, and Ms. Lizette Bell, Deputy Director of Health Services and Chief Nursing Officer at the Ministry of Health and Wellness. Good morning, ladies. Y'all so bright, so Friday vibe. How are y'all feeling today?
Good morning.
Good morning. Thank you so much for joining us on our couch.
Thank you for having us.
To talk about this awesome program. Yeah.
So,
Ren?
so what we were discussing to help give a little pathway of how we're going to have this conversation. We have a lot of young viewers too as well that tune in, and I don't believe we actually had Belize Chamber of Commerce on as yet to explain the services of what they are. So what I wanted to do is give the opportunity for Ms. Cattouse to give just a synopsis of what the Belize Chamber of Commerce is, and so people can get an understanding of what you are about.
All right, so thank you for having us, and good morning, everyone. Good morning, Belize. So the Belize Chamber of Commerce and Industry has been in business for over 100 years. It is a private sector membership-based organization. And what that means is that it is a body that businesses, people who own a business, they can join it as an association. They can become members. And what we do, we provide support to them. So we are a business support organization that provides support to the private sector. So if you are a mom and pop business, a micro, medium, large, you can join the chamber. This is an organization that, as I said, we support you. The business community, they need advocacy so that they could operate in a better enabling environment. So that's what we do. We work with the government a lot. We also do a lot of training, capacitating, because every day is changing and you have to keep up with it. So we offer that hand-holding so that you don't have to do it alone. And as I said, we are in business over 100 years, so we really know what we're doing. And we are here to support each other. So the businesses who have grown, they actually help and support the smaller ones that are coming up.
Love that. Belizeans building other Belizeans.
I'm blown that you're working for 100 years. Wow, I did not know we have such association that's been so long in the country.
Ask the questions, Kevin, get to know the history.
Yes,
like,
yes.
wow, because we learn a lot also on the show. You tell us things like that, and I love that.
Right. It's not owned by one person, it's owned by its membership, and it has existed because it's the same members who put back into it. So, we have executive council, they provide guidance, and it's the same businesses who are members, they serve on the executive council every 2 years. So they ensure that the chamber survives.
I love that. And we know that nurses are ensuring that people survive all the time. And so I really want to think about, you've mentioned that BCCI also has this tendency to support. And so can you tell me why choose the nurses? Or what was the idea that came behind saying we need to do a give back initiative to the nurses?
Yes. So I can start off and I'll pass it on to Ms. Katherine. The chamber, as I said, we are engaged with our members and with the businesses. And since COVID, we've been there. We've been supporting the government. We sit on several committees to provide advice and guidance in the perspective of the business community. And we come back to our business members and we share that information. So since COVID, we've done a lot of educational courses about the pandemic, what it is, even about vaccination. We've been partnering with the Ministry of Health and Wellness since then, even locally, the PAHO.
Okay.
We have also had international bodies who supported us, International Labor Organization. We are an official representative for the International Labor Organization in Belize, in the sense that we represent the voice of employers. So they have reached out to other international partners to help support Belize so that we are on board with everything what's happening. Most recent, we've tried to be supporting the COVID, the vaccination, and we even realized about the nurses, the work that they've been doing. So We have Miss Katherine. We actually have an in-house committee, which is chaired by Miss Katherine about all these initiatives that we've been doing. So I'll let her take it.
Sure, and you did a fantastic job, so it's just to compliment. Good morning, Belize, and yes, definitely. So just to add a little bit more about the Chamber before we get back into our main topic today, we have been incredible advocates, and we are fans of entrepreneurship. And it's worth mentioning that a large number of our members are small and medium-sized businesses and even micro businesses. So the support that we can provide to these micro businesses, these small businesses, especially those that are young and still developing and have that entrepreneurial spirit, that's really important to us. And as we were discussing, the audience and different things of that sort, I wanted to reference that. Coming back to the nurse initiative, we all know how challenging COVID has been, and it's really been, quite an experience to say the least, so to say. But what we wanted to do, and there's so many frontliners out there. There are people talking about COVID. There are people supporting. But we really identified that in this particular case, we wanted to narrow our support down to the nurses because we feel they're really in the front line every single day, right? In many ways, in terms of the vaccination efforts, in terms of being able to help persons, recover and stay alive, right? And be as healthy as possible. Then there's more than just, we talked about this before, there's more than COVID. Diabetes. There is, these chronic diseases, if we want to describe it that way. We also have our tropical diseases, malaria, etc., that are still a part of the reality.
Definitely.
And so most definitely, they must be recognized and appreciated. And we felt that the month of February, right, the month of love, as they say, would be a perfect time for us to be able to do that. And this initiative, one of our main goals and something we talked about from the very start is to be able to give back to the nurses, not only within the principal urban areas, but across the country as well. So this is a give back initiative that's going to be supporting the nurses directly across the country. And that's where we've been working very closely, as Yorshabell has referenced, with the Ministry of Health and Wellness. And it's always been fantastic working along with Mrs. Bell. So we immediately contacted her, asked her about, give us the numbers, give us where you think this give back could be most impactful. And so that's what we're doing. We're finishing up our logistics to then roll this out on the 14th of Feb, the week of the 14th of February.
Awesome.
That's our intention.
We love it. We love that partnership and to hear, you're giving back to people that are giving to our community as well. Yeah, most deserving indeed.
I love that you mentioned it's not only COVID that's taking place. So they're not only stressed with COVID, they have a million and one tasks. And I have friends that are nurses that tell me that when there's a double shift, you just go to it, you answer that call because you know that people need that help. And that's just the selflessness that comes with being a nurse. So I can clearly see the need to give them the love that they're giving to every single body. And what I do like, because we mentioned this before we got onto the live, is that these were all speculations. They were whispers into the dark about something happening in Valentine. So for all the nurses out there, there's something coming for you. The whispers have become real. And so could you tell us a little bit about the logistics behind how many, because you mentioned that, nurses across the country, but how many nurses, what will this give back, this initiative look like for them?
Okay, this initiative is focusing on our nurses in the public health system. So it's nurses from Corozal down to Punta Gorda, all the way to our rural communities. So we are looking at recognizing approximately almost 500 nurses within the public health system. So we plan to have these events in every single district. Okay. So it's going to be done in 6 different, or 7, because we consider San Ignacio and Belmopan separately. And so we will have these events at the health facilities to recognize them throughout the month of February, starting in the week of the 14th.
Oh, so it's like a love package. You just
Correct.
And you get your little love box or whatever it is.
Yes.
But we can't say what the end of the box, or you have to.
No. We can't say what is the package, but it's individualized for each and every nurse. So every single nurse is going to get one. It's not something that is going to be for the health facility. It's for the nurse to recognize their efforts, what they have been going through. It's for them to realize that, yes, their work is not being unseen. There are persons out there recognizing the hard work that they are doing, and they have been doing before COVID, and COVID also has brought on other challenges for nurses through these last 2 years. And of recent with the Omicron, it has been even more challenging for us because, yes, we don't have hospitalizations, but we have healthcare workers being infected with COVID because of the high transmissibility. So last week was very difficult for us. We had about 35 to 38 nurses out with COVID. This week we are down to 28. This is nationally. So that means that the other nurses have to pick up the slack. We try our best to bring on sessional nurses to support where we can. And that is how we keep the services functioning. So I am glad to recognize BCCI for this effort, for recognizing our nurses and their efforts and all their members, because it's their members who made this happen.
That's what I was going to ask. What is your overall feel about this partnership, and what does it do for the nurses? I'm sure that it boosts your morale, but is there like anything specific that you feel changes with such initiative?
Of course, definitely it motivates them. It boosts their morale, and it allows them to realize that, you know, yes, I came into this profession. I love my profession. I do what I do best to care for my patients without expecting anything in return. But at the same time, there are persons out there recognizing me. And I am glad that these initiatives like these are out there, because it really helps in an environment where it's kind of stressful because of the pandemic. We have to accept it. And in addition to that, the extreme shortage also cause additional challenges for you as a nurse going to work. In the past, you could say, I am assigned here to this ward, and you come prepared to function and work. By the time maybe 10 o'clock, everything changes. And you need to move from this area to the other area, and you have to be flexible and adjust as you go along throughout the day. That is how we have been handling for the last 2 years. That we have to make constant adjustments and reorganization. And those are the things that are occurring behind the scenes that people don't know, that they see the services are there, but what it is to keep those services flowing for the community.
I really thank you for that.
And thank you, nurses. Thank you, everybody that's watching us, like the nurses.
Like that. What I have to say, and it just dawned on me, and I don't think we mentioned it, but I think it's something very vital to mention, is the fact that with this initiative, the business, the private sector that's giving back and all, you're giving back during COVID. So everybody, you know, you're kind of like, you're done your struggle, but you're trying to make ends meet. So to do something like this in this time also shows how much love that BCCI has for these nurses, because these businesses have to keep themselves afloat too as well. And so they're taking out of their profits, they're taking out of their time to give back as well to the nurses. So, and I think that is something very important to highlight, because we know that these goodie bags come from somewhere, right? And so to think that too, I think that's super important to remember.
So in line with that, I see a lot of sponsorship on this ad. And I believe it's not only February where we give back to the nurses and give them love. So is there space for more people to sponsor and for this initiative to continue any further past February?
Oh, most definitely. And starting off, you know, we would really like to thank all our members and even other members of the business community that have been supporting this initiative as they hear more about it. Yes, if you know, we are very thankful for what we've received thus far, and we appreciate any additional support. Whatever we are receiving will go directly back to the nurses as well. So it's just a transition. What we wanted to do is be able to pool all of this together and prepare something, connect with the ministry and identify the best way to get this across and to give this back to those really working on the ground and show our appreciation for all of their hard work as described, right? Many times we don't understand what's happening when we walk into a healthcare facility or a clinic, but there's so much in the back end. She's given us a little taste, but I'm sure there's a lot more as well.
Yes. I'm sure there's just not sacrifices and the work that you put within the health system, but they also have lives. So there's sacrifices that you have to take in your personal life as well. So it's a really good way of saying we see you, we acknowledge you, and we thank you for what we're doing. So thank you to everybody within the nursing department, Ms. Bell. Continue.
And the mental health as well, right? They're there every day with COVID, with persons with COVID. That's taxing, right? Taxing on you, taxing on what happens when you go back home.
Yes.
Right? There's a lot to think about.
They sacrifice a lot for us every day. And on that note, I want to ask Ms. Bell, as we're wrapping up this segment, I wanted to have you have the opportunity to talk to the viewers at home, the public, in regard to the nurses. What would you like to see us, the people, do more for them when it comes to however we act in our day-to-day life? What would you like to see for us? What would the nurses need from us?
Okay, as a community, I would like to see that we try to deal with the prevention measures. Yes, we are nurses, we are here to provide care for you, but what we would like to emphasize, it's your non-communicable diseases, COVID, the best thing is prevention.
Yeah.
Try to go to your primary health care clinics to have your diseases under control so as to prevent you to get hospitalized and have to come into the health facilities. In addition to that, I would like to appeal to the public at this time to have some patience when they go to the health facilities at this time because of the shortage. Our nurses also are being affected by COVID. So you may have to take a little longer at the health facilities right now, but you will get care. I assure you that you will get care. However, we are begging the public to be patient as well with the accessing services. In addition to that, I would also like to ask the public to continue the partnership because we do have at the different local levels and the different health facility have different partners in the community who do support the health system and recognize in different ways the nurses and the needs of healthcare workers. So I also would like to thank the community and ask them to continue to support the health system and the healthcare workers because we are there to care for them.
Thank you so much. And I reflect on that and say that's the truth too as well when you think about everything that's happening. We have to have a lot more patience with the systems that we have at hand.
Yeah.
I think people we live in this era, quick, and we don't remember that there are people behind these doors that are trying to get things functioning with limited resources, limited human resources, and it's very hard.
Yeah.
So
And that we all play a role in addressing our health system, in staying COVID-free. It's a community effort. So nurses, as much as we, the community members, have a key role to play in staying healthy. So thank you for that reminder to our viewers. Absolutely.
And I want to thank, sorry.
So if anyone wants to give to the initiative, they can still do so.
Okay.
Because we're going to start packaging next week. So they could contact us at 223-5330 or WhatsApp us at 614-3138. And even if you are a micro business, you can give. We've had micro businesses who donated stuff because every little thing will fill the basket. So, I mean, we've had people that said, I'll give you 10, I'll give you 20. So all of that adds up. You don't have to have a lot of money. We've had even individuals who worked at institutions, private sector, they've also give, so everything will add up.
A little goes a long way. And so it's the real thought and gesture of just giving back in some way, shape, or form that shows these nurses how much we are appreciative of their services.
I would love to see their faces when they get packages. Please do the recording. We would love to see it. Yes.
See their packages, please, Miss Mel, please. I really appreciate it. I will definitely play it out here because I know also the nurse, I think it's Nurse Day is coming up in May too as
Yes,
well. So
in May.
we're gonna definitely have that
celebrating.
show to show all the love in February about what's
Yeah,
happening.
we'd love to see that. Yes.
But with that, we end off this segment and we go to our next commercial break. Again, thank you so much,
Thank you
ladies,
for being
Thank
here.
you as
Thank you
well.
for having
being
us.
here. And we're hoping that all of the sponsorship, all of the love starts to pour in, and also the patience for all the nurses and all of the frontline workers start to pour in from your side too, viewers, because you have been called to and asked to do something. So let's please work on ourselves too and our patients. But with that, we go to our next commercial break. When we're back, we're going to be talking to Katie Usher about what's happening in London. Stay tuned for that exciting conversation. We'll be right back.